is Ashley Hauser, and I'm a nursing student. I'm going to be taking your health history, if that's fine by you.
Okay.
What is your name and date of birth?
Shad Hauser.
Date of birth?
Oh, May 1374.
And your age?
44.
And what gender do you identify with?
Male.
And your race and culture?
White.
White. Your religion?
Christian.
And your level of education?
I got a Bachelor of Science.
Marital status?
Married.
And your occupation?
A nurse.
Your income?
Good.
Okay, how many members of your household do you have?
4.
Means of transportation?
I own my card.
Okay. And what brought you into the clinic today?
Right knee pain.
Right knee pain? Okay, do you have any other symptoms?
No.
No? So you said it was right knee pain, correct? And then is the pain gradual or is it sudden onset?
Consistent.
Consistent? Okay. And on a scale of 0 to 10, how would you rate your pain?
About a 5.
A 5? Okay, so is it sharp or dull?
No.
Dull? Okay. And then any symptoms with your pain?
No.
Does it radiate?
No.
Do you take any medications for your pain?
Motrin.
Motrin? How much?
800 milligrams.
How often?
Twice a day.
And does it help?
A little bit. It keeps it about a 5.
Okay. And when you don't take your Motrin, how do you rate your pain? From a scale of 0 to 10?
About a 7.
7? Okay. And does your pain affect your sleep or your appetite?
No.
No. Do you have any other coping techniques?
No.
Have you had any past surgeries?
No.
Okay. Any injuries or disabilities or disorders?
No.
No. Any major childhood illnesses?
No.
No. Any major adult illnesses?
No.
When was your last physical?
A month ago.
A month ago? Do you have an advance directive?
No.
No. Any previous x-rays?
To my knee.
To your knee? Right knee?
Mm-hmm.
And how long ago was that?
A month ago.
A month ago? When was your last TB test?
About 4 months ago.
4 months? And your last dental exam?
Years.
Years? And your last vision exam?
Probably 3 months ago.
3 months? And your last hearing exam?
About a year ago.
Okay. Are you up to date with your immunizations for
Yes.
all of them?
All of them.
Did you get your flu shot this year?
Yes.
How much and how often do you exercise?
2 or 3 times a week.
And when you exercise, about how long does it last?
30, 35 minutes.
Do you smoke?
No.
Do you drink alcohol?
Occasionally.
Do you drink caffeine?
All the time.
And where do you get your caffeine from?
Coffee.
Coffee? Do you add extra salt to your diet?
No.
How would you describe your sleep pattern?
Good.
Good. How many hours of sleep do you get?
6 to 8.
Do you have any work stress?
No.
Okay. Do you take any over-the-counter drugs?
Other than my Motrin?
Mm-hmm.
No.
No? Do you have any prescription drugs?
No.
No. Do you have any allergies, seasonal food?
None.
None? Do you take any illegal drugs?
No.
Do Do you have any family history of high blood pressure?
No.
No? Do you have a family history of cancer?
Yes.
Okay. Which side?
Both.
Both? What type of cancer?
Skin.
Any other?
No.
No? Okay. Do you have any family history of any heart problems, lung problems?
Heart problem.
Heart problems? On what side?
Both.
Both? Any specific heart problems?
High cholesterol. About every one of them except my dad had a heart attack.
Oh, okay. Okay. Do you have any psychiatric difficulties?
No.
No? Any history of them?
No.
No? Any family history of hepatitis?
No.
No? Any family history of sickle cell?
No.
No? Alcoholism?
No.
Have you had any family members die of an unknown cause?
No.
No? What is the usual condition of your skin?
Good.
Good? And of your hair?
Excellent.
Excellent. What about your nails?
Good.
Good? Have you had any bruising, lesions, dryness, any
No.
hair loss, masses?
No.
No? No itching?
No.
No newer recurrent conditions?
No.
No. Have you had any headaches, dizziness, trauma,
No.
loss of consciousness? Any newer recurrent conditions?
No.
Have you had any cataracts or glaucoma?
No.
No. Any newer recurrent conditions with your eyes?
No.
No. Have you had any ringing in your ears, like with tinnitus?
Yes.
Yes. Do you get motion sickness or any feelings of uneasiness? No. Any problems with your nose?
No.
Nasal polyps? No. Nasal infections?
No.
Ear infections?
No.
Throat infections?
No.
Do you have hearing loss?
Yes.
Do you have any abnormalities with your teeth or your mouth?
No.
And then what's your usual mental and psychological ability?
Stable.
Stable? Have you had any previous psychological conditions or disorders?
No.
No. Any newer recurrent conditions?
No.
No. Have you had any seizures or aphasia?
No.
Any tremors or tingling?
No.
Any newer recurrent conditions?
No.
Do you have varicose veins?
No.
Do you have high blood pressure?
No.
Do you have any heart murmurs?
No.
Any congenital conditions?
No.
Do you have atherosclerosis?
No.
What was your last EKG?
4 years ago.
4 years ago? Have you had any lumps, nodules in your neck or groin with any infections?
No.
No. Have you had anemia or Hodgkin's disease?
No.
No. And any history of exposure to radiation?
Other than X-rays, when I work as a nurse?
No. Okay. Have you had any coughing?
No.
Do you have asthma?
No.
Any shortness of breath?
No.
No. Have you ever had a respiratory infection?
Yes.
Yes. What type?
Tonsillitis. I had my tonsils taken out.
Okay. Have you had any changes in your ability to walk, stand, lift, pull,
No.
carry things? No. Have you had any previous stomach ulcers, intestinal ulcers?
No.
No. Are you anorexic
No.
or history of anorexia?
No.
No. History of flatulence?
No.
Have you had any stomach or intestinal infections?
No.
No. No new or recurrent conditions with your stomach or your
No.
intestines? No. How would you describe your excretion patterns?
Okay.
Okay. Do you go every day?
Yes.
Are they regular?
Yes.
What is a usual diet for you in a 24-hour period?
I eat 3 meals a day.
3 meals a day? And do your meals consist of any particular foods?
No. Just whatever there's there.
Okay. And who buys and prepares your meals?
I do.
You do? And do you have any food preferences?
Meat and potatoes.
Meat and potatoes? Do you have any braces or dentures or anything that can affect your chewing?
No.
No? Have you ever had any hemorrhoids or rectal bleeding?
No.
No? When was your last rectal exam?
Never.
Never? Do you have a history of any urinary problems or conditions?
No.
No? No diseases?
No.
No? Have you ever had fibrocystic diseases or any lumps, breast cancer?
No.
No? No tenderness, nodules, lumps?
No.
No? Have you ever had a mammogram?
No.
No? Do you perform self-breast examinations?
No.
No? Have you ever had any problems with erections or ejaculations?
No.
No? Have you had any problems or like any conditions with your vas deferens?
No.
No? Any sacral masses?
No.
No? And when was your last prostate exam?
Never.
Never? Do you perform self-testicular exams?
Yes.
Yes? How often?
At least every night, take a shower.
Do you have any back pain?
No.
No? Any fractures?
No.
Any new or recurrent muscular or skeletal conditions, diseases?
Other than my knee somewhere, something's going on? No.
Okay. Do you have any deformities?
No.
No? Any limitations?
No.
No. Do you use any assistive devices?
No.
No?